Good afternoon, everyone, and welcome. Thank you for joining us today. My name is Jenny Bankston, Manager of the Affiliate Business Partnerships with NACCHO, and I'm excited to welcome F&T Labs as NACCHO's newest Diamond Affiliate Business Partner. Today's session will introduce you to PH360 and explore how AI can support local public health professionals in their day-to-day work. Just a note, this session is being recorded. We have a great turnout today, so we're excited to have you join us. With that, I'll turn things over to the F&T Labs team to get us started.
Thanks, Jenny.
Over to you.
Thank you, Jenny. Hi, folks. Thank you so much for joining. My name is Nebu Kolancherry. I'm the Chief Revenue Officer here at Flourish and Thrive Labs. Flourish and Thrive Labs is a consulting company that works with state and local health departments, and we pride ourselves in being for public health by public health. What that means is all of our folks are former public health officials, just like you, and come into any engagement understanding your work. We're very excited to show you PH360 today. But before that, some introductions. I'm Nebu. Like I said, I'm the Chief Revenue Officer here. So I work to build relationships with folks like you in order to make sure that we can solve your problems. My background is in public health. Immediately prior to this, I was the communicable disease director at the St. Louis County Department of Health. Over to you, Jefferson.
Thanks, Nubu. Hi, everyone. My name is Jefferson McMillan-Wilhoit. I am the Chief Executive Officer for Flourish and Thrive Labs. And I have been in public health. Every time I have to say this, it shocks me. I've been in public health for 16 years. My background is as an epidemiologist and biostatistician by training, but immediately prior to this, I was the Chief Information Officer for a local health department in Illinois. And super excited to share with you our PH360 product and hopefully answer some of your questions about it.
Thank you, Jefferson. So let's jump right in. We're really excited to show you the product, but before we do that, just a quick note on how we think about this. So no ifs, ands, or buts. Our perspective on this is public health must use AI. It's a must, and it's an imperative. And here's why. Public health today is being asked to do more so than it ever has, with fewer people and less money than we've had in decades. And just the math doesn't math. And AI is part of that, is one of the only tools that we've seen that can help, right? For years, the fixes that we've actually needed, so more funding, more staff, modern systems, they've been promised, but they've never really arrived. And AI could be the first tool that actually allows all of us to move the needle together without waiting on an external miracle. So the question isn't whether, it's how. It's how are we going to be using AI to support our teams and to help our communities, and what kind of AI? So if you've been told to go look into AI and haven't found a path that you'd actually trust, that's who this webinar is for today. I hope that you can walk out of here with one concrete step to help you and your agency, whether or not you become a PH360 customer. Let's talk about what AI tools that work in public health need to have. It's, from our perspective, it's three things. First, they should be purpose-built for health, so that for public health, so that you do not have to vet as much the information that you're getting. The second is that the way to do that is that it's bidirectional. It has good guardrails. So every answer needs to be checked both ways, going from you to the tool and back at you, so that every answer can have a cited source and can tell you when it doesn't know. And the last thing is consistency. It needs to have the same answer every time that are tied to those sources, so that you can trust the answer you get and from a tool that you're using that leverages AI. Again, the goal here is you are the public health professional. We often tell people, use AI for things that don't require your head or your heart. That's you, that your relationships, your brain, that should stay there. On the other hand, AI could be a really great intern that you can supervise. And that's how we think about AI use in public health. And that's kind of the basis for how we've built at PH360. The second part of this is I want you all to think about every single workflow that you do. And workflow is that the series of steps that you use to execute a certain task. So anything like I imagine many of y'all are dealing with a cyclospora case. So let's say you get a report, that's intake, that some doctor says, hi, I've got a patient that has cyclospora. Great. You take that, you triage it, you sort it, you process that information as a health professional. You may or may not consult an external reference guide. So that could be your state's communicable disease manual, that could be your department's SOP. Then you take that, you come up with some sort of an output. That could be a response to that health professional, that could be you filling out a case surveillance form, and then you communicate that back out, right? So every public health workflow works on some version of these 5-step process. What we're asking is that y'all should think about using AI within the constraint of those 5 steps to either make each one of those steps faster or help with the handoff between the steps. And that's kind of what you'll see when Jefferson demos PH360 to you today. So if you take that in mind, again, the first thing I showed you, which is that you should have AI that you can trust, and the second is that AI that works in your workflow, you'll see that that's how this maps to sort of two concepts that you'll see today. The first is maple, and the second is oak. All of our modules are named after trees because we like trees. I wish I had a better answer for you. And so maple it works similar to how any AI tool that is a chat-based tool that you might work with today. So you put in a question, or you ask it to do a task and gives you a response. That's sort of straight out of the box, but straight out of the box with those public health guardrails by citing sources that you can trust and consistent answers every time. The second is Oak, which is a no-code agent builder, which can help you execute on that 5-step process that I showed you, right? So what it does is it allows you to identify a workflow, give it instructions, and have it draw from specific bodies of knowledge that you reference on your daily basis so that you can make those steps and your workflow faster. Now, so we're very excited to show you those today, but sort of what's next? If we have time, we'll get to it. Once you have that foundation, right? So Maple and Oak, and Birch is sort of our admin app about how to administer users. Then what you can do is kind of build apps on top of it. So we are going to start with Willow and Spruce. Willow is for clinical case management. Really, how do we do public health nursing, vaccine visits, billing, so that your department can do what your community wants and recoup the revenue without having to spend an arm and a leg on a full-blown EHR. The second is that 5-step process lends itself really well to environmental health inspections, right? So going and doing restaurant inspections or sewage or wells, et cetera. How can we make that better? Leveraging AI at the baseline so that it's AI native and can help inspectors do their job better in the field. So that's where we're going next. But I'm going to stop sharing my screen at this point and show you what you came here to see, which is the product itself. So over to you, Jefferson.
Awesome. Thank you. Thanks, Nabu. All right. We're going to get this up and running. And, Zoom is always a fun time for everyone. So I'm just going to look for just a quick thumbs up that, yeah, great. All right. Lovely. Okay. So like Nabu said, we're going to be going through 2 of our main modules today, Maple and Oak. We're going to start in Maple though. And I do, we're gonna much like we like trees, we also like the Wizard of Oz. So we're gonna pretend that we're at the Emerald City Health Department today. It's always fun to have a somewhat fictitious health department to work out of, given that we've all worked in actual ones for a while. So Emerald City Health Department's Land of Oz. Everyone should be pretty well familiar with that. So I'm going to play a couple of different roles. I'm going to have a couple of different hats today, and I'll tell you what I'm doing, who I am at each of those points to just show you a little bit about what PH360 can do. But before I show you that, I always like to start with what can this thing not do? And this is a really important point. So I'm going to ask Maple to tell me to create a retirement party for our financial director, and that I want a funny toast for it. And what you're going to notice is that Maple responds and says that falls outside of my request, my abilities. And it's because we have locked PH360 down to be public health only. So every general, right, if you think about it, every other general purpose assistant, AI assistant out on the market today that you could potentially look at, it's going to be able to instantly and cheerfully respond to that. What ours doesn't. And there's a reason for that. The reason is that part of our challenge when we think about using AI in public health is making sure that there are good AI practices. And to expect anyone in public health to be able to to have to learn how to be a good prompt engineer, to have to learn what to ask it and what not to ask it, is a lot to ask for everyone who's like doing 3 jobs already. And this is supposed to be making that easier for everyone. So I always like to start with like, what is this not going to do? Now let's go through what it will do and how it can help. So the first thing that we're going to look at is just our public health reasoning engine. So our public health reasoning engine is built for general purpose public health requests. So for this one, we're going to be working a salmonella cluster tied to a temporary food vendor. And what I'm asking Maple to do is walk me through how I would structure an investigation across environmental health and EPI, what cold holding requirements are for a temporary food establishment, what notification obligations might look like, and what we should be capturing right now for the after action review that we may not be able to reconstruct later. And you'll notice that as Maple is built, as our reasoning engine is going through all of that, it is showing you what it is building. And that what it's building is finalized. Once everything turns green, that's how you know that it's final. Our public health reasoning engine is built off of national standards. So things like what's published from the CDC, what is published from FDA, what is, even what is in NACCHO model practices, those all feed into our public health reasoning engine. So I like to think about this as like your generalized public health friend, right? They don't know anything about your like local establishment. It doesn't know anything about your agency and its policies. All it really knows is the national best practices. And you can note it, like even as we were doing that, you can see like it did a lot. And if I were to have to like go and build this over and just like spend the time to actually put all of this together, that probably would have taken me at least an hour, maybe if not an hour and a half. And so let's just take a quick look at its structure. So it's giving you what the EPI workflow is. So my immediate priorities. It's looking at cohorts and case control design. It's giving you laboratory information. And then it's giving me the environmental health workflow. So immediate vendor inspection priorities, temperature documents. And it's, here's cold holding requirements. So following reflects the FDA Food Code framework, and it's very clear that it is not what the state adopted. This is the national version. And then it gives us potential notification obligations, but it's not claiming anything that it doesn't know. And that's what's important about our public health reasoning engine, is that it's all grounded. Everything is grounded in that information so that you're not getting. We've really built this at multiple levels to reduce and mostly prevent those hallucinations. It's always going to tell you when it doesn't know something, and it's always going to tell you when at what level it knows something, even to the point that down here at the bottom, it's going to say that this is based on the model's general knowledge, not on grounded sources, meaning that we didn't provide it with anything. So that's really just like the public health reasoning engine on its own. One of the other things that the public health reasoning engine can do, and really any part of Maple can do, is it can draft Word documents for us, which is a really common thing for us in public health. So all I'm going to do is I'm just going to ask it to draft an incident situation report for the outbreak. I gave it a date, I gave it an incident number, I gave it those 6 sections, and then I gave it some facts that I want it to use. And it's going to go through and it's going to draft those for me. And it's going to output it as a Word document. Now, what is unique about the way Maple works is one of the things that we've heard is that You really want to be able to work with the document with the AI, right? It's not that you want the AI to produce a document, then you have to download it, then you have to edit it, then you have to go back to the AI and like have it do all of these different things. We really want to be able to use the AI in our workflow so that you're never leaving it. And so what Maple does is it's going to generate that first draft for you. Once that's generated, I'll be able to open it and review it. So two things are really important about that. One is we don't just allow straight downloading of Word documents without somebody reviewing it. Remember, our whole goal and design decision here is to help to enforce good AI practices. And good AI practices means we review everything that the AI produces for us before we accept it. The second piece about this is I can change this and then go back to ask the AI to do something different. So if we just scroll through here, we look at the epi summary, and let's just say that, for whatever reason, I wanted, as this was coming in, I got new case reports. So I want to confirm cases to go to 23. I want 31 to go to 38. 38. And then let's see, my total cases to go up to 61. 61, and then we'll do 326. Okay, so I'm going to just mark that as reviewed, and notice that I couldn't download it until I do that. So I reviewed it, now I can download it. And when I download it, it'll download, and I'll just I'm going to open it, and then you can't see it because, well, Zoom. Could open it, it opens as a docx in Word, you can see it. But the more powerful thing here is that, okay, so I just made those changes. Now I want to go back and update that, and I'm going to give it some more information. So I'm going to say that one of the confirmed cases is actually a food employee who reports working shifts August 15th and the 16th while symptomatic. The person in charge attributed employee GI symptoms to the heat and didn't exclude. So what it's going to do is it's now going to take that information and it's going to update my sections for that incident report with that new information. And what you'll notice is it won't override the changes that I made in the epi section. So that's what we mean by when we say like being able to work with our AI assistants instead of having to do and in our workflow, rather than having to like go through all of these different things. It's going to tell me what it added, so I have a very quick idea here, and then it will at the end, and then I'll be able to open it up and I can re-review it and notice that my counts are still the same, just like I updated 23, 38, 6, 61, all as well, but it added those additional pieces for me. So that's the power of AI that allows you to work, right? Output to a document, work within the document, go back, give it more information. And so you're constantly able to have PH360 open for like as your always ready assistant. So the other thing that you can do that is important within Maple, and we're not even talking about like the localization piece, but we want to be able to work with multiple documents, right? So what I just showed you is generating a document, but what if we have a whole bunch of documents that we want to use for something? So I'm going to just upload a few documents here. So all I'm doing is dragging and dropping those in. So I've got some extreme heat guidance memoranda, and I've got my municipal code, and I'm going to put in my emergency operations plan for extreme heat response. And what I'm going to do is you'll notice that those are updating, and what I'm going to ask it to do is only using those 3 attached documents, and I want it to cite it. I want answers to very specific questions. Now, it's doing PDFs. These are pretty large documents. And you can imagine like your documents are probably pretty large too. And what it's doing is breaking down each one of these documents into its individual parts to then be able to grab and cite those answers when we ask it the question. Once it's done, then I can send it. And now what it's going to do is it's going to use all of that cited information to start generating our response for us. And here's what it'll give us. It's approved cold holding methods, and it's citing exactly where it got it from. So it got it from the municipal code, 12.4.0. And it's going through and it'll do that for each one of these. And it's giving pretty good and reliable answers. If we had time, I would open these documents up with you and show you that that's actually the code that each one of those things has, and that we could cross-reference and cross-check each one of those things, and it's going to be accurate. And that's because PH360 has that built in. It has all of those cross-checks built into it. Okay, so that's general. That's Maple without any localization at all. But we all know that public health is inherently local. So we've had to figure out, how do we allow and help local health departments bring down bring down to the local level and add that local context to the public health reasoning engine. And the way that we do that is through our app called Oak. So you may or may not have heard about agents. Agents are just containerized ways of working with AI. And so we tried to make this really, really easy. Normally, outside of our platform, like if you wanted to build an AI agent, you'd need to know Python, or you'd need to know all kinds of other things. We guide you through this process without needing to know any code at all. So the process, it's really a 6-step process. We start it, so we'll start from scratch. We will give it a title, and because we always use the same one, I like to always give it a date with us. We give it a description. This is just to make things easy to find. And then we tell it what we want the agent to do. So what should the agent do? And you're just answering questions. It's like, what do we want it to do? We tell it it's an senior environmental health and communicable disease advisor. We want it to answer from the knowledge base. We give it some, information. We're sort of getting our brain into this agent for us. But more importantly, we need to tell it what to do if it doesn't know something. And that's probably the most important part about this. And it's say so plainly, never guess, name a document. And if for whatever reason you don't know any of it, send the user to the EH director for code, the epi manager for cases, or the health officer for legal questions. So that's its instructions. And then you're going to just upload your documents. So for this, I'm going to upload that the extreme heat document that I had before. I'm going to upload my municipal code. I'm also going to give that EOP, but I can also upload Excel files. And the cool thing here is that if you give it an Excel file, it actually will be able to do math on that Excel file. It'll be able to run statistics on that Excel file, which AI inherently does not do math well, but we've built an engine to help the AI do math, and it's repeatable and it's reliable. So I just uploaded a Salmonella a line list, sort of carrying on our themes. And then I uploaded an inspection report. So, this can take some time to do just because it is an agent and it's going into our fabric. So I've started that process. The next thing that you have to do once you have the knowledge in there is we require you to test it. You have to test it. So I always ask, what knowledge is in your knowledge base? And that's just to, good AI practices. We want to make sure that the instructions that we gave it and the knowledge that we gave it are correct and good for what we want to use. So it'll go through that. It'll test it. The last part is to activate it, which means that we can share it with a whole bunch of people. We can either share it with just with ourselves, we can share it with specific people, or we can share it with our entire organization. Now, once the agent's built in Oak, we can access it in Maple. And that's the cool part. So I'm going to just go to, let's see, we'll go to our PHAB accreditation assistant. That's one that comes out of the box. And so what we'll ask our PHAB accreditation assistant is, for anyone who's going through PHAB accreditation, you'll be able to see that this is correct. What measures are currently needed in domain 1 for initial accreditation? So that's going to go and it's going to go and look at all of the documents that we uploaded for this. So in this case, it's the standard and measures for 2026, as well as a whole bunch of other documents that help uh, go through the accreditation process. And it's going to give me a readout of what those measures are within domain one. Now that, right, it's more than just a control F on a PDF. It's actually it's taking all of those pieces of information and trying to put it all together. Um, and what it's going to come back with is a pretty coherent answer for me that I then can use to make a decision on. So notice that it's saying it's verifying its sources. It'll give me the readout. So here's all my measures. But more importantly, not more importantly, as important is it cites the source and it gives an evidence grade. It says how confident am I in the evidence that I'm providing? So that's a whole bunch of what Maple and Oak can do. And just a quick note as to what Nabu said. Once we got that down, once we could do AI, like secure, reliable AI, we can now start doing really cool things like building Willow, where we can have the electronic health record that we all wish we had in public health that doesn't require us to have all of the things that an ambulatory EHR or hospital EHR would have. And it all runs and is powered by that AI interface, the source engine, the public health reasoning engine, and the agents. So with that, I'm gonna stop sharing my screen.
Hey, Jefferson, exceptionally well done, staying on time. So given all that, um, so we're going to go to questions now. But if folks would like to um, try this for free, you can scan this QR code or go to that website and sign up for a free 2-week trial. Would love to get y'all on the platform and see get your thoughts on it. All right. So Jefferson, can we go through some questions now?
Yeah, you tell me what you want to answer. You
Sure.
answer what you want to answer.
So we had a question about whether or not it can upload, accept state level regulations as an upload. So Dr. Layton, I hope you saw both of those things. You can either upload it as part of Maple or you can create an agent with it, both of which Jefferson showed. There was a question, does it pull it all from scientific research, or sorry, scientific literature? Jefferson?
Yep. Today, the public health reasoning engine does have some authoritative scientific literature, like MMWR. That the public health reasoning engine is all curated by those of us here at FNT, so it goes through an editorial process. So we don't have, like, it's not going to access PubMed, it's not going to access like everything in the scientific literature, but where we have felt it is important to have certain pieces of literature, it does have that.
Thank you. Lauren asks, is there any chance to highlight the areas that were changed or updated or add to the document? So that was during the Maple demo. And yes, you can just ask it what changed and it'll tell you, or you can see it on the preview, but it does not highlight it on the preview per se. It's sort of a version control thing. The second question was, does it automatically cite this tool at the end of the report? So in exported Word documents, which is what you saw when you click generate document and it shows on the side, there's a footer in every exported document that says co-created with PH360 AI assistance. Whether or not y'all want to leave that in there is up to you, but it comes with it there as a footer. There's a question that says, does it help with Word only? How about PowerPoint or slide graphs or icons? So currently it is live with Word documents. PowerPoint is on the roadmap. Slide graphs and icons, that's depending on how you want to look at it. Jefferson, I guess you could generate HTML or...
Yeah, I mean, it can generate HTML code. If we're thinking about just like graphics to go in a slide, it can generate that.
Fantastic. Sophia asks, can you create an agent that includes our policies and procedures, even if some of the content is in exclusive public health? Yes, but it will only answer questions that are public health related. So so even if you create an agent, all questions and answers go through the reasoning engine. Jefferson.
which has all of those guardrails in it. And I do think the important part to note about an agent, so if you're just doing Maple, so a lot of people will ask, like, can I just upload documents to Maple? And like, what's the difference between doing that and doing an agent? So Maple, if you're just uploading documents, you have a limit of 10. Agents, unlimited number of documents can go into an agent, and the agent keeps memory. So it's keeping a memory of like how is keeping track of like what it answered previously, so it doesn't contradict answers that it gave before.
Great. The next question is, there's some questions about the link, and I'm fixing that so that y'all can have it. My apologies. There is a question on if this is recorded. Yes, this session is recorded. Jefferson, the next question is, from the care administrative perspective, is PH360 an ONC certified solution for HL7 transmitting of information?
Good. It is not ONC certified, because that means that we would have to essentially be an ambulatory EHR. However, everything underlying it is HL7 on fire. So all of its APIs are fire exposed. If you want to talk to me more, like I'd love to have a conversation with you about why that decision was made, as well as like what it does have that allows for that HL7 transmission. So please feel free to, on our website, schedule a meeting. I'd love to dive into that more.
Excellent. When people add their own documents, does that get incorporated into the overall knowledge base?
Oh, yeah, that is a really, really good question. It does not. So every health department gets its own little PH360 house to live in. None of your information goes to anywhere else, and no one else's information comes into you. And so everything just lives within your own little environment. So if you upload a document, if it's not in an agent that you shared with somebody else, no one else can access it. And that's part of our security infrastructure to make sure that this is fully safe.
Excellent. How big is the context window for the documents it uses? Is the backend using RAG when it reasons, or is it all directly storing text? Wow.
Whoa, I love that question. So document upload is 25. So you have 25 megabytes per document to upload. There is no limit on the size. However, it's not just a RAG. We're using full vector searching. And so it's not, before going to the model, it's doing a vector search so that it's only pulling the context that's needed. So it's not overloading the context window. That was a really technical question. I love whoever asked that. Thank you.
All right, moving on. So it will only include national source up. I think that's in reference to the reasoning engine, Jefferson. So when national sources are updated, will it only include those updates?
Correct. Yep. And that's because the public health reasoning engine is, we editorialize it. So anytime that there's an update, we will update it. Do you want me to take the next one?
Yeah, I can't believe we didn't touch on that.
Ryan, thank you so much. I appreciate you deeply. Yes, it is fully identified. That line list has PHI in it. Again, I could open it, but just for the sake of time, I don't want to. Again, PHI, that's one of the big parts about PH360 is that you can put PHI in it, you can put PII in it. It is fully secured. We are audited to SOC 2 standards, as well as we support everyone's HIPAA compliance. We sign a BAA. Any of our clients we sign a BAA with to ensure that we can do that. And that's also how we can support things like Willow. So that's one of the key benefits is your staff doesn't have to think about, like, can I put this into an AI, because it's secured. Our platform is secured, so you can pretty much put anything into it.
Great. Does our own PH360 live within your servers at your company or in my department?
So we use AWS as our hosting partner. It does live within our virtual private cloud. So what that means is that everyone's tenant sort of lives within inside of our virtual private cloud, but like your database is your own database with your own key, and everything that passes back and forth between that database to the agents are their own thing. Every agent you build is its own runtime in our fabric. So it's not like you're sharing that with anyone else. And then you're right, your data is your data. So when you decide you're done, we don't keep that data. It gets deleted on a retention schedule that is because it's because we have to maintain HIPAA compliance. We keep certain things for 6 to 7 years, but most everything gets deleted.
Jefferson, we had a question related to that from Dr. Layton. So who owns the information that is uploaded into PH360? And additionally, who owns the output generated from PH360?
The department. You own it. We don't own it. I can't, like, even as an admin, I can't access your database. Like, that's just a thing that we keep security on.
Great. Would we be able to build agents for community partners to use, or would they also need a subscription to PH360?
That is a really so we've gotten that question from a couple of folks. Today they would need a license, and you can always go to our website to see what the different license types are. But it has been something that people have brought up a lot recently, and so we are investigating being able to push that out to community partners. And right, a lot of the things that we're building, like Willow and Spruce for environmental health, are going to have that functionality in it because they have, or already do have that functionality in it because they have like community portals. So making that available through Maple is definitely something we're considering.
Great. If local documents can be uploaded and referenced and may have different guidelines to follow, can they override national guidelines? So I think within the context of OAK.
Yes. So the way that the public health reasoning engine works is it looks for a local requirement first, or a local document first. So something that is localized to you through an agent or through a document you upload. If it finds it, it will use that information. If it doesn't find it, then it goes out to the national corpus. If it finds something in the national system that it can, in our public health reasoning engine, the national piece, it will cite that and use it. If it doesn't have something in either one of those, it will say it doesn't know and stop. So I like to think about it as like these concentric circles that the reasoning engine's working from.
Great. After the 2-week free trial, how much would it cost a health department annually, and is there a limited number of users? There is not a limited number of users. Our pricing is on that website that's the one that's on the screen, and it's the one you go to get the free trial. So if you go just scroll down, you'll be able to see that we have population-based pricing. What that means is that this is priced to be accessible to smaller health departments, and you can get a reasonable estimate for how much it would cost there. There seems to be some sort of flaw in the account creation process. All right, well, let Frank, I'll reach out.
Yep, so if you have any issues at all trying to get into a free trial, send Nabu or I an email and we will take care of it for you.
Yep. My apologies, Frank. We'll fix that for you. Okay. Lewis Davis. So this is in response to the RAG answer. So RAG embeddings use vectors, but the vectors you are using are not RAG.
Yeah.
Yeah.
Lewis, send me an email. Let's schedule some time to chat. I'd love to chat. I would love to nerd out with you about this.
Great. I know we're talking fast. We just want to make sure to get to all your questions, given that we're already over time. Any more? We're happy to take them.
It looks like Amanda sent one after the 2-week free trial. How much would it cost a health department annually? And is there a limited number of users?
Yep, that was the pricing question that we answered.
Sorry.
No, you're good.
Totally missed that.
No, you're good. So Amanda, just to reiterate, pricing is on our website. There is no limited number of users. So it depends on how many people your health department serves. And you can go ahead and calculate that on the website or reach out back to me and I'm happy to send you a quote. All right. Anyone else, folks? Jenny, we'll leave it up to you. We're happy to stay on, or we can end the webinar whenever you're ready.
Thank you, Nabu. Well, this will conclude today's presentation. Many thanks to F&T Labs for their presentation. And again, they've given you the information to follow up with questions and inquiries. And thank you all for your participation.
Thanks, everyone.
Good afternoon.
Thank you all.